Okay, next speaker is my own colleague from our Psychotic Disorders Division at McLean Hospital, Dr. Virginie-Anne Chouinard. She's the Director of Research at the OnTrack program for first episode Psychosis at McLean and staff psychiatrist in our Psychotic Disorders Division. Come on up.
Thank you. It's a delight to be here today with this wonderful group. It's been an inspiring day, people coming together to try to find the best paths forward to improving mental health. My area is in early psychotic disorders, and I'm excited to share our group's work on metabolic mechanisms and the potential for metabolic interventions to improve trajectories in psychosis. Early intervention is critical in bipolar disorder and psychotic disorders like schizophrenia. Decline in functioning can often begin early and have a major impact on people's work and schooling, relationship, and their ability to meet their goals. Current treatments have serious side effects like weight gain and motor side effects, and don't sufficiently address several major areas. Some of these include bipolar depression and cognitive deficits and overall global functioning. So we have an urgent need to develop new treatments for early intervention that work better for people and have less side effects. People with schizophrenia have a 2 to 3 times higher risk of diabetes, obesity, elevated cholesterol, and these metabolic abnormalities contribute to a decrease in life expectancy, largely due to cardiovascular disease. But these are not just internal medicine and cardiology problems. We're learning more about how the brain is involved in these metabolic conditions and how the brain is affected. There's several lines of evidence now that show us that we have dysregulation in brain energy production and use and mitochondrial dysfunction in psychotic disorders. This evidence comes from imaging studies, PET, phosphorus magnetic resonance spectroscopy, or MRS, and cell studies. These dysregulations are highly relevant in the brain, as the brain uses 10 times more energy per unit weight than other organs of the body. Energy that's needed to maintain the machinery for neurotransmission, synaptic plasticity, and major brain functions. We've focused our work in 2 areas of metabolic dysfunction that are promising for metabolic interventions. The first is brain energy metabolism, and in a series of studies using phosphorus MRS, we've identified specific brain energy metabolism and redox deficits. And we've also been interested in insulin resistance, as insulin plays a role in the brain in regulating energy metabolism. In using phosphorus MRS, we're able to non-invasively quantify major factors involved in the production and use of energy and redox regulation. Fei Du and Dost Unger in our group have developed approaches to be able to measure NAD and NADH metabolites in the brain. The redox pair of NAD and NADH lie at the intersection of multiple critical biochemical pathways. Major metabolic pathways rely on redox reaction, for which NAD is a co-substrate, like glycolysis, the TCA cycle, the electron transport chain, all of which produce ATP, which is the major currency for energy in cells. Some of this might sound familiar from biology classes, where you had to calculate the number of ATP produced from glycolysis and the TCA cycle, but these are the processes that we're measuring here. What we find in psychotic disorders is that there's a significant reduction in the NAD and NADH ratio. We see this in first episode Psychosis, and you can see there up on upper right, where we have patients on the left, siblings that fall in the middle between patients and control participants. And we also see this reduction in NAD and NADH in chronic course schizophrenia as well. Using an approach called magnetization transfer, we've also found a decrease in creatine kinase activity. Creatine kinase helps produce ATP when there's energy demands in the cells, and so we see this in early and chronic course psychotic disorders. And what we're seeing is that there's differences in how ATP is being generated. Alongside this work in the brain, we've also found a reduction in insulin action or insulin sensitivity in both early course psychosis and unaffected siblings who are at risk for developing psychosis. And what these findings show us, along with others, is that there seems to be an endogenous risk or shared risk between glucose abnormalities and psychotic disorders. We've also found that insulin sensitivity is associated with cognition, in particular working memory and attention. So right now, our next steps are using these metabolic markers so we can simultaneously probe underlying mechanisms in vivo and develop new treatments. As a psychiatrist working with young adults every day who are looking for relief now, I really feel the urgency to that we need to be doing more to advance understanding mechanisms and at the same time developing treatments. This is a study that we did of intranasal. This is a study we recently completed, looking at the acute effects of intranasal insulin on cognitive function and neurometabolites, including glutathione, a central factor in response to oxidative stress. So we included patients who had early-stage psychotic disorders and control participants, and they underwent MRS scans and cognitive assessments pre and post administration of intranasal insulin. We're still analyzing this data now, but we have some interesting findings showing improvement in processing speed, in cognition, as well as modulation of a glutathione of GSH, which appears to be related to baseline insulin resistance. So more to come on this, but I think this is an example that shows a study where we're using a probe to study mechanisms and creating a dynamic environment. We recently just launched a randomized control trial of the ketogenic diet funded by the Bazooki Family Foundation. And in this trial, we're targeting a model of redox and bioenergetic dysfunction by switching the brain energy's fuel source from glucose to ketones. By restricting carbohydrates and increasing fat, the body starts to use fat as its primary energy source and produces ketones. There's compelling evidence showing that the ketogenic diet can be beneficial in psychotic disorders, and there's also some evidence showing that it can modulate metabolites like NAD and NADH, and so we're going to be measuring that in this trial. Over the course of 12 weeks, people will be either following the ketogenic diet or a Dietary Guidelines for Americans diet, and we'll be measuring phosphorus MRS and proton MRS along with fMRI and DTI measures over the course of the 12-week RCT, and then we have an open label phase following another 12 weeks. So we're very excited about this study that we just started and its potential to target our bioenergetic markers and redox markers, as well as insulin resistance. And of course, we're looking for improvement in mood and psychotic symptoms. I don't have time to go into this with the lightning speed, but we've also have a trial ongoing now in bipolar depression and first episode bipolar disorder. I mentioned that as an area of clinical need, and we're looking at magnesium and vitamin B6 to see if we can improve depression and stress. So key takeaway points, I would say, is that we have promising targets now for early intervention, including ketogenic therapies, and that we can really use these metabolic markers to probe mechanisms and develop new treatments. I want to acknowledge individuals and their families who have participated in our research, and also our wonderful multidisciplinary team and collaborators in our group in the Psychotic Disorders Division, led by the wonderful Dr. Joe Stunger. Thank you.
Hi, nice talk. The changes in energy metabolism that you can measure using MRS and so forth, is it occurring all across the brain, or is it occurring in specific regions of the brain?
Oh, yeah, great question. So the data that I was showing is collected in the prefrontal cortex.
Right, but what about the rest of the brain?
So far, this is the area that we've really studied, in addition to the occipital cortex, and so that's the area that we're really targeting in these trials.
Hi, thanks for the great talk. My question is, people with 22q11 deletion syndrome have a 20% chance of developing schizophrenia, and they have reduced levels of taurine and arachidonic acid. So I'm wondering, in your study, if you do any kind of genetics, like to distinguish out subgroups?
Yeah, great question. Are you in the ketogenic diet study? So we're not doing any genetic tests in that study, although that would be interesting. And throughout the day, I've been thinking of all the great things we've heard in the talk. It would be nice to have the AI emerald as well in the trial, but we're not looking at that. No.